Growing number of U.S. clinics marketing unproven stem cell treatments, study finds. Stem cells represent for some the promise of a cure from disease or relief from chronic pain conditions, and businesses have taken notice, opening clinics that market different stem cell treatments directly to consumers. While the use of unapproved stem cell therapies is commonly associated with international stem cell tourism, a new analysis in the journal Cell Stem Cell indicates that this marketplace may be much larger in the United States than previously thought. By using Internet keyword searches, text mining, and content analysis of company websites, UC Davis stem cell researcher Paul Knopfler and University of Minnesota bioethicist Lee Turner found a total of 351 U.S. businesses offering stem cell treatments in 570 clinics throughout the United States. Clinics were found throughout the country, with California, Florida, and Texas having the highest number of clinics. Similar clusters were also seen in certain sites, most notably Beverly Hills, followed by New York and San Antonio. Symptoms of heart attack in men versus women. Boy develops potentially deadly food allergies after receiving blood donation. The majority of clinics advertised autologous treatments, which means using stem cells that come directly from the patient, usually from fat cells or bone marrow. However, an estimated 1 in 5 clinics marketed treatments with stem cells derived from other people, and 2 clinics offered bovine amniotic cells to patients, meaning cells derived from the amniotic fluid of cows. The purported treatments offered by these clinics were varied, with the most common interventions advertised for orthopedic issues, followed by pain, sports injuries, neurologic conditions, and immune disorders. The authors note specific concern about the marketing of treatments for conditions such as Alzheimer's trademark S disease, for which there is currently no consensus from the medical community that there are safe and effective stem cell treatments. James Hendricks, Director of Global Science Initiatives at the Alzheimer's Trademark S Association, shares these concerns. Although there are clinical studies being conducted to assess the safety and efficacy of stem cells in the treatment of disease and injury, he stressed that it is important to make the distinction between what is research, and what is ready to be sold and marketed and provided to patients. The treatments offered in these clinics are unproven and not tested appropriately at this point, Hendricks added. There are trademark S no way to confirm that any of these clinics are providing stem cells, let alone whether they actually work. His points echo those made by Turner and Knopfler, who note that some clinics may not be meeting federal regulations regarding cells and tissues. From around 2009 to the present, businesses have been entering the marketplace on a routine basis. They've been coming in making marketing assertions about stem cells treating 30 to 40 different diseases, and no one's taking meaningful regulatory action, Turner said in a statement. Does that mean that people are getting access to safe and efficacious interventions, or is there basically unapproved human experimentation taking place where people are going to these businesses and receiving experimental investigational cell-based interventions without being given a meaningful account of the lack of knowledge and evidence that they're being charged for? Turner added. For now, it seems additional discussions into the ethical, legal, and medical ramifications of these clinics are needed. Per Hendricks, stem cells and stem cell research may lead to really great new understanding of disease as well as new therapies, he said. But that is a step separate from what these clinics are doing today. Drive.